If you've been told you need back surgery, whether it's for a herniated disc, spinal stenosis, degenerative disc disease, I want to help you pause and think it through. Surgery is permanent, and far too many people go under the knife without exploring their full range of options. I'm Dr. Chris Cameron, and in this video, I'll walk you through why many spinal surgeries don't produce long-term results, the key questions to ask before committing, and what non-surgical options might still be available even if you think you've tried everything. Let's dive in. Here's what most patients aren't told. Spinal surgeries don't always lead to relief, especially for chronic pain. In fact, a major study in the journal Spine found that patients who underwent spinal fusion were less likely to return to work and more likely to need long-term pain medication than those who avoided surgery. That's not to say that surgery never works. It's absolutely and can be in the right case, but the success rate varies widely depending on the condition, the procedure, and most importantly, whether the real cause of the pain is being addressed. Pain is a complex scenario. It's not always caused by what you can see on a scan. And if your surgery fixes structure without restoring function, the pain often returns. Let's talk about MRIs for a moment. If your scan shows a disc bulge, degeneration, or stenosis, it can be scary, but scans don't tell the whole story. Plenty of people have a scary looking MRI and no pain. Others have intense pain and a relatively normal looking MRI. How is this possible? Pain is influenced by more than just structure. There's inflammation, nerve sensitivity, joint mobility, joint stability to consider. So before you commit to surgery based on what an image shows you, ask, has anyone actually tested how my spine is moving, how my nerves are functioning, and how stable is my core? Because those are often the missing pieces. At our clinic, we've helped many people who were close to booking surgery find relief and recovery through a more complete and structured approach. It's called our BackStrong Framework. It's not just chiropractic care. It's not just exercises. It's a step-by-step, research-based system designed to relieve pressure, reduce inflammation, and rebuild spinal stability. Here's how it works. Step 1 is spinal decompression. This gently creates space in the spine and takes pressure off compressed discs and nerves. Studies published in Pain Practice Journal have shown that decompression therapy can lead to a 90% reduction in pain for chronic disc patients. We use this to help relieve the root cause, not just the symptoms. Step 2, deep tissue laser therapy. Laser therapy reduces inflammation, speeds tissue healing, and helps calm nerve sensitivity. Research in Lasers and Medical Science and the Journal of Laser Therapy has found that Class 4 laser therapy can significantly reduce pain and improve healing outcomes in chronic back and nerve conditions. It's painless, drug-free, and a proactive, proven, effective approach, especially when combined with decompression. Step 3, guided rehab. Once the pressure and the inflammation are under control, we rebuild, strength, and stabilize. We target the deep stabilizer muscles of the core and spine, the ones that protect you from re-injury. The 3-part plan, relieve, repair, rebuild, gives your body the best shot at healing naturally without surgery. Now, to be clear, there are times when surgery is appropriate. If you've lost bladder or bowel control, have progressive muscle weakness, or have structural instability that simply can't be resolved conservatively, surgery may be necessary. But for most chronic disc and nerve conditions, there are often a window of opportunity to try something else first. If that window is still open, it's worth exploring, because once you've had surgery, there's no going back. So if you've been told surgery is your only option and nothing else can help, I want you to know this. There may still be another path. The BackStrong Framework is helping people every week avoid surgery, reduce pain, and get back to living again. naturally. If you're not sure whether it's right for you, the next step is simple. Give us a call, 519-227-1363, and schedule a BackStrong consultation. We'll take the time to understand your story, assess the real source of your pain, and let you know, honestly, if we believe we can help. No pressure, no guesswork, just real answers, and a plan that puts your back in control. Wherever you are on this journey, we're here to help you.